Federal employees and retirees approaching age 65 are often unclear as to how the various parts of Medicare work with their FEHB plan. The part of Medicare that usually generates the most questions, though, is Medicare Part B. For this reason, we'll focus on Part B in this video and how it relates to the FEHB program for both active and retired employees. Those of you nearing age 65 likely already know that Part A is premium-free and Part B requires a monthly premium. Many people refer to Part B as the doctor portion of Medicare, but it's much more comprehensive than just coverage for outpatient and inpatient doctor visits. Part B covers services at 80% with an annual deductible. Along with doctor visits, Part B covers outpatient hospital care, outpatient diagnostic tests such as x-rays and laboratory tests, durable medical equipment and supplies, physical and occupational therapy, ambulance transportation, and other outpatient services. Many federal retirees want to know, why should I pay Part B premiums every month when my FEHB plan covers these same services? There are some big advantages for those enrolled in Medicare Parts A and B. Almost all fee-for-service plans within the FEHB program will pay the 20% that Medicare doesn't pay. Those same plans will waive their deductibles and coinsurance for most medical services. They typically allow you to see any provider that accepts Medicare assignment anywhere across the country without referrals, even those providers outside the plan's network. Some plans even pay for medical services when outside the U.S., something Medicare doesn't cover. Also, most fee-for-service plans will coordinate with Medicare electronically, so you won't have to file paper claims after going to the doctor or hospital. For many people, all these factors add up to peace of mind and a greater sense of security in retirement. For others, it may just be a matter of dollars and cents. It really depends on you and your family's needs. If you decide not to enroll in Part B and you're enrolled in a fee-for-service plan within FEHB, you will likely have to pay your plan's deductible, copays, and coinsurance amounts up to the plan's yearly catastrophic limits. If acute care is needed in any given year, it may translate into several $1,000s out of your pocket. You should compare these out-of-pocket costs to the amount you'll pay for Part B premiums for you and your spouse per year. You should also consider you and your spouse's health status in the years preceding age 65. An interesting NIH study shed some light on when our healthcare dollars are spent during our life cycle. The results show that on average, we spend more than half of our healthcare dollars in our golden years. And when longevity is on our side and we live to 85 years and beyond, 2/3 of our expenditures will come after age 65. If you decide not to sign up for Medicare Part B when you're first eligible, you may be charged a late enrollment penalty. The penalty is 10% of the premium for the first year you do not enroll and is permanent. For every 12 months you are not enrolled in Part B, the premium penalty increases in 10% increments. There's one big exception to this rule, though. When you turn 65, the late enrollment penalty doesn't apply if you are enrolled as an active employee under FEHB or are covered under your spouse's group health plan and he or she is an active employee. In this case, it doesn't usually make financial sense to enroll in Medicare Part B just yet because your health plan is still considered the primary payer. Once you or your spouse stop working or are no longer covered by the group plan, you'll have an opportunity to enroll without a penalty during a special enrollment period. This 8-month time frame begins the month after you retire. You also have the option to enroll at any time while you are covered by the group health plan. In the Medicare section of all FEHB plan brochures, you'll find the primary payer chart. This detailed chart outlines when Medicare is primary or secondary according to your employment status and other factors determined by Medicare. We've covered a lot of information about Medicare Part B, and there are probably some special situations out there that we didn't have time to cover. Your best and most accurate sources of information on all things Medicare are the Medicare.gov and SSA.gov websites. To learn about how GEHA health plans work with Medicare in retirement, visit geha.com/Medicare. Thank you for watching.